My name's Adrian Shepard. I'm the Global Medical Marketing Director for RECKITT, based at the headquarters back in the UK. I've actually worked on our OTC portfolio of products for 29 years now, and I'm a microbiologist by training. So, antimicrobial resistance is one of the greatest health threats we as a planet face. Resistance has been developing to antibiotics almost immediately that they were discovered, and that is accelerated over the course of time, and fewer antibiotics are now available. What we know is that resistance is complicated, but one key area where it does develop very frequently is when antibiotics are inappropriately used for respiratory conditions which actually don't benefit from antibiotics. So around 12 years ago, knowing that this problem was escalating across the world, RECKITT brought together a group of experts, the Global Respiratory Infection Partnership, to address this issue. What as RECKITT could we do to tackle this problem? We can't fix it all, but what is the role that RECKITT can play in addressing that when we know inappropriate antibiotic usage is high for common conditions like cough, cold and sore throat? We are all led in this fight by the World Health Organization, the WHO. They've created a global action plan to tackle inappropriate antibiotic usage, and it defines 5 big pillars of action. One of those areas is to raise awareness and understanding of antibiotic resistance, what it is and how we address it. Another area is actually to prevent infections, so that's a key area in terms of hygiene vaccinations that's important. When it comes to government, all governments have an obligation to create a national action plan which aligns to the WHO's global action plan. So we as RECKITT have a role to play in engaging with governments in delivery of their national action plans, understanding what the national action plan is, what it is each individual country commits to in delivering that, and how we as RECKITT can help in that objective. Some governments, for example in Mexico, very keen to know what more they can do and how they can learn from RECKITT and the experts that we work with to address that issue more effectively across the region. And that's exactly what we'd like to do within the ASEAN region, partnering with governments, with policymakers across the region and particularly within Malaysia. Yeah, so I would say the most successful one we have at the moment, as an example, is in Mexico. So we've actually got a meeting coming up in a couple of months' time with the government on antimicrobial resistance. We will have some of our global experts speaking at that meeting, really to convey the approaches that are taken elsewhere in the world. No one has this perfectly right. And all governments are looking to learn from the approaches that are taken elsewhere in the world, particularly if they've got a very big problem to face. Often we look to the countries, for example, like the Netherlands, who've got the lowest levels of inappropriate antibiotic usage and low levels of resistance. So we've all got a lot to learn from countries like that. And the question is, so how can we adapt those to the environments that exist elsewhere in the world? And that, we believe, is an opportunity for us as RECKITT as we form partnerships with policymakers, with the healthcare professionals on the ground, and with the governments. An example would be also in the development of guidelines. Guidelines ultimately guide treatment choices. So if you have guidelines in place which say when you should or shouldn't take an antibiotic, when you should take symptomatic relief, those can ultimately guide treatment decisions, and as the patient interacts with the healthcare professional, they will have the clarity in terms of what they should and shouldn't do. That's a key area which we think is important as well. So antibiotic resistance is complicated. We talked a little bit about how that's driven by inappropriate antibiotic usage and how that antibiotic usage is high in conditions like sore throat, cough, cold and flu. That's particularly important when you think about what the patient actually needs. So if that patient is in pain and they're suffering, they need effective solutions. They need something which is going to tackle the symptoms effectively, needs to be evidence-based. Not all treatments are the same, and we at RECKITT take the evidence base very seriously. We want to make sure that our products work effectively, repeatedly for patients in delivering the symptomatic relief they need. Strepsils Max Pro would be a prime example of that. It's a product that we started working on back in the 1990s. More than 20 clinical studies underpin that product. We've looked at it for both viral and bacterial sore throats, and it's effective irrespective of what the cause is. And it provides that symptomatic relief that antibiotics simply don't provide. Antibiotics don't work against viruses. Most of the sore throats, most colds, most coughs are caused by viruses. So therefore those patients need effective evidence-based symptomatic relief. That's what we like to achieve and deliver through RECKITT to our countries around the world. And we've got that here in Malaysia with a spray and a lozenge format. So the problem of antibiotic resistance varies depending on where you are in the world. What we know from our survey work of patients, of consumers, is there's an awful lot of misunderstanding, and that's because antibiotic resistance is a very complicated area. Now, the degree of understanding varies dramatically, and our job as RECKITT, as communicators to consumers, is to help educate them, to raise awareness and change those misperceptions. We know those misperceptions are particularly high in the younger generations, perhaps because they're not as health literate as the older generations. They haven't suffered as many coughs, sore throats, and therefore don't know what works for them. And that's our opportunity as RECKITT, is to drive that education of the consumer. Give them the solutions that work, help dispel the myths that are there, and we know within Southeast Asia those myths particularly high related to what antibiotics can and can't do, what resistance actually is, the fact that it's the organisms within the body that develop resistance, not the person, the organisms. And once you've been exposed to antibiotics, those develop naturally within your body, and you can carry those for up to a year after you've been exposed, spreading it to your family members, your friends. So there's some clear myths that we need to dispel in a positive way for consumers so they can more effectively treat their condition. Sore throat, many symptomatic relief options there. I believe our Strepsils Max Pro is amongst the best that are available. So this is a fight we're in for the long term. Remember that there's going to be continuing generations coming through, and we need to be thinking about those generations that are to come. So how might we reach school-age children? How might we reach healthcare professionals that are in their academic part before they go out into the workplace, make them better aware. And then this is going to be a generational thing that will then need to transition through. Behaviour change is not quick, it's not easy. It takes concerted effort over many, many years, and we believe we've got a role to play. We can see that across the globe. There's vast differences in approach, vast differences in those misperceptions. And what we believe as RECKITT is we need to focus on a few of those misperceptions and really give the communication, the awareness and understanding to our consumers, to our healthcare professionals, to bring about more effective treatment of those patients and more appropriate use of antibiotics. So our GRIP group, the Global Respiratory Infection Partnership, as the name suggests, are a partnership of experts from around the world. They represent pharmacists, infectious disease specialists, physicians, specialist physicians, and academics. And they come from a range of different countries. And because the approach that you need to take to tackle this problem is very different country by country, it's important for us to learn from them. So we bring these experts together and we listen. We listen, we ask our questions, they brainstorm amongst themselves the approaches that could be taken that might make a difference. We've brought those experts here to Malaysia, and we wanted them to really understand the situation on the ground. What is the interaction between the patient and the doctor, the patient, the pharmacist, and the patient and the specialist, like in the Malaysian context? And therefore, what can we do as RECKITT to address that? What can our experts do? What can they suggest as educational initiatives which might be useful for those professionals, but also for the patients to give them better treatment approaches when it relates to conditions like sore throat? How do we make sure those antibiotics are used appropriately when they're needed, but not inappropriately when actually they're not going to benefit the patient and are just going to drive resistance? So tomorrow we're going to be bringing a group of experts from the Malaysian environment together with some Malaysian experts, with some of our GRIP experts, to discuss this problem in more detail and propose some alternative approaches, give some of the data that we've gathered from around the world and get some reaction on what they can do as individuals to drive this agenda forward. We can't do it alone. It's a partnership. It's a partnership with our experts. It's a partnership with healthcare professionals on the ground in the individual countries. And it's the dialogue between the patient and the healthcare professional where we believe the opportunity lies to make real difference. Yes, from a Southeast Asia perspective, this is coming new, but as RECKITT, as GRIP, this is an initiative we've been driving for over 12 years. So we are in this for the long term. We've spent a lot of time with the LATAM team trying to understand what we can do in the Mexican environment, the Brazilian environment, but now ASEAN, like how do we do something active in the ASEAN region, and that's the focus. We know we're going to need to bring together experts locally. It's no good us bringing lots of experts from across the world. We need the experts on the ground locally within Malaysia to help us in this journey, because it's all about partnership. Partnership across the different healthcare professional audiences, but also us as RECKITT with our interventions with consumers, with patients, and the effective solution products that we offer. Symptomatic relief is a key way in which we can reduce that inappropriate usage. Good hygiene practice is also very, very important. If you prevent infection, people don't get sick. If people aren't sick, they don't ask for antibiotics. So we believe through the portfolio of products we have as RECKITT, through our partnerships with experts on the ground in Malaysia, plus our partnership with experts beyond, we can make a difference now and in the future. And we will keep at it until we've fixed this problem of antibiotic resistance. I think RECKITT can be an initiator. We already know that there's leadership from the individual countries. They all have national action plans. So the government, the policy makers do have leadership in this area. Our job is to be a partner and have a role in it. We can't lead everything. As I mentioned, it's a complicated area. It involves animal health, it involves the environment, and it involves the human. Well, we don't have involvement within some of those areas, so we can't fix that problem single-handed. But we can play our part, and we're keen to be a partner in helping governments achieve their national action plan, be ambitious in their national action plans to achieve more, and think about ways in which we can measure change, how we can bring about that behaviour in the interface between the doctor, the patient, the pharmacist and the patient. That's the opportunity area that we feel and where our product offerings are part of the solution. It's very important to work in partnership. Ultimately, we want better served patients. Private companies, private health providers want better served patients. Patient retention is very, very key in the private sector in particular. So better, more effectively managed patients is good for everyone. I think it does need to start with the consumer or the patient. Ultimately, a lot of their misperceptions are what are driving the pressure on healthcare professionals to give out inappropriate antibiotics. They know it's not right, and ultimately it's not good for the patient, it's not good for the healthcare professional, and it's not good for resistance as a global problem. So how, through our partnerships with professional societies, can we empower them to be the educators? They can then drive the awareness. They're trusted by their patients, be that doctors, be that pharmacists. Patients trust them. They just have these misperceptions that have existed perhaps for many, many years, but they trust those healthcare professionals to educate them and give them the right information and the right solutions to fix the problem that they have at that particular moment. If that's an everyday sore throat, knowing that for the vast majority of people, it's going to be better. In 7, 10 days maximum, it's going to be gone. How do they effectively manage those symptoms during that period, but how do we also ensure that we're not missing red flags? How can we make sure that that patient is appropriately monitored? And if they do need antibiotic treatment, they're getting it in a timely fashion from the right healthcare professional. That we believe is part of our role as RECKITT. So cure is an interesting terminology, and antibiotics historically are thought of as cures for conditions. We've got to remember, for most of these conditions, they are self-limiting. So they have a finite time span, 7, 10 days, 14 days at an absolute push, and your immune system will effectively manage that on its own. That doesn't mean that patient isn't in pain, they haven't got symptoms, and they ultimately want relief of those. So yes, it would be tempting to think of a cure-all, but that's not the case when it comes to many of these viral infections where there is no cure. So rhinovirus is the major cause of cold symptoms, of which sore throat is a predominant symptom that occurs early within the duration of that illness. There aren't any antirhinoviral drugs available, so there is no cure for that condition. All you can do is manage those symptoms and allow the patient's effective immune system to deal with the problem. The same is true of many other viruses. We're into a scenario now where we do, for COVID, for example, have some antiviral drugs that can provide a cure. There are vaccines that can prevent infection, but that's not true for many of these respiratory infections. And remembering that we all need to continue to be vaccinated on a regular basis if we don't want to come down with those new variants. So curing, I think, is something to aim for. In the case of viruses, there aren't many cures. For bacterial infections, antibiotic can be a cure, but in order for that to be effective, we've got to preserve them. We've got to keep them for problems that are life-threatening, for when death is a consequence. For everyday sore throat, cold and flu, it's unlikely that people are going to die from those conditions. And therefore we need to preserve those antibiotics for when there is really the chance that death, and give them the credit that they're due. They're precious medicines that need to be preserved for the future. So my one message is, this is a massive problem that we're facing, but individuals can make a massive difference. So look for the ways in which you can make that individual difference. As a patient, do I need an antibiotic? If so, why do I think I need it? And discuss that with your healthcare professional, your doctor or your pharmacist. Tell them what it is you want. Maybe it's the symptom relief that you're actually looking for, not the cure, as we discussed previously. For the healthcare professionals, think about those patients. Where are the opportunities to raise awareness, understanding, and educate them? If they've got misperceptions around antibiotics, how might you be able to correct those misperceptions? Because if you correct them now, maybe they're not going to come back next time with those misperceptions, and we can change their behaviour away from wanting inappropriate antibiotics to getting the appropriate solutions, symptomatic solutions in the most part. For the government, national action plans, let's make those challenging but achievable, and think about ways to partner in achieving those national objectives. Look to learn from others who are also going through exactly the same challenges as you are. So those would be my messages across the spectrum.
Perfect.